Welcome back. The Africa Health Agenda International Conference Commission is underway. The conference focuses on the state of universal health coverage on the African continent, and the conference comes as the country recently observed the one-year anniversary of the first case of COVID-19. And for more on this, we're joined by Dr. Shakira Choonara, Youth Ambassador of the African Union. Thank you so much for coming on to our program. Surely health matters are of concern to all, but with the major focus of this conference, what exactly do you intend to discuss there?
So actually, Colin, we've wrapped up today, and it's been 3 intense days of speaking about universal health coverage, or as Africa knows it, South Africa knows it, the national health insurance. It's been 3 days of talking about how will Africa recover from the pandemic. How do we build more resilient healthcare systems? There's been a lot of discussion about specific health issues, for example, cervical cancer, where we don't have vaccines for women and girls on the continent, despite the burden of cervical cancer. We also spoke a lot about HIV, the growing burden of non-communicable diseases, so diabetes, etc. And finally, it was quite exciting to see a big youth voice within all of this. And again, the discussions were really centered about how do we build back better in terms of our healthcare systems on the continent.
All right, so one of the points you raised in there is how do we recover from the COVID-19 pandemic? We've had a push and pull regarding which vaccine exactly should we use. And on the other hand, going forward, we are possibly facing the third wave. So any suggestions from your conference?
Look, I think it's not so much the conference, but it's also the existing evidence that's been coming out. I think we do need to look at the vaccine, which is the most effective in South Africa. We saw the debacle around the AstraZeneca vaccine. And so I think that the decision makers and people who are in power need to really take into consideration what's the age of the South African population, which vaccine will be effective, how will we roll it out, and then make their procurement decisions based on this. I would say that initially our procurement decisions were not that well thought through.
Some interesting points coming out of the discussion there, especially with regards to cancer-related illnesses. You referred to breast cancer, but on the other hand, you'll remember the debate around how expensive medication and treatment of cancer is like in this country.
Definitely, and I think, so you have the bigger forms of cancer where we're starting to provide care for. What the pandemic has also done has disrupted services. So, for example, there's been patients who require hysterectomies or who require other cancer treatment who've been turned away because the health system has now been so geared towards COVID. So we need to also think about, in our emergency response, how do we make sure that healthcare services go forward? When it comes to cervical cancer, there's an increasing link between cervical cancer and HIV. And cervical cancer is preventable, yet we don't have a vaccine for cervical cancer. So these were some of my favorite points coming out of the conference, because it's starting to show policymakers where to focus. And for example, I've just been part of a commission on this conference who's launched a report on the state of universal health coverage on the continent. And so I think it's going to be very important to be able to lobby and influence policymakers and show them the path in terms of what are Africa's problems right now and how do we start and begin to address it.
So now going forward, as you're talking about national health care, when we look at the imbalances and the gap between the rich and the poor, we still really have a problem with regards to access of health care services and medication, as well as nutrition that would really boost that. With the current levels of the aftermath of COVID-19 and lockdowns, many people find themselves in a corner where they have been unemployed, and there's going to be discontinuing of the 350 grant. So there is imminent hunger and food security on the cards here.
Definitely. I think that the COVID pandemic has put us in a dire situation on the continent. It's disrupted our schooling, it's disrupted our healthcare system, and importantly, it's disrupted our economies. And I think recovery from that is going to be very difficult. It needs to be prioritized immediately. What this Commission on Universal Health Coverage has shown that before COVID, the current state of healthcare on the continent is quite weak. We have, for example, only 48% of people on this continent getting the care that they need. So, Colin, it speaks to your point around, the inequities in terms of health financing. What we're finding is that almost 96 million Africans are unable to pay for their health care, or if they pay for it, they're pushed into poverty. And situations like COVID-19, where people's jobs have been taken away or their education has been disrupted, means that the citizens on the ground will not even have that extra cash to pay for services that they usually used to be able to pay for.
All right. Thank you so much for making time to speak to us. All right, Dr. Shakira Choonara, who is the ambassador of the African Union, speaking on health-related matters, and of course speaking to us on issues that have to do with the addressing the challenges of COVID-19 as well as cancer-related diseases.